Thank you very much. I'm really enlightened to be here. So it's my first time I'm in VIT, and really your campus is excellent. I have heard about VIT from my college days. So I'm a graduate from University College of Medical Sciences, Delhi University, and then I did my post graduation from Maulana Medical College. So, but way back in Ranchi in Bihar, Jharkhand, we have such an institute. So we should all be proud of it. And so, without wasting time, I'll start. At the onset, I'd like to thank Jharkhand Science and Environmental and Sciences this festival. And I'll just briefly tell you what I am going to talk about. So, headaches. One is the headache thing, and then is the migraine and environment. How these are correlated. So, I'll start with a very simple thing. Migraine and headache. This is a very common in our society, and there are many environmental triggers actually, which actually trigger the migraine. So this topic has been very well selected actually, because in neurology there are many things like movement disorders, stroke, many things are there, but the migraine is one of them where there are triggers, and this trigger is very important when we talk of exacerbation of the migraine. And the environment is very important when we talk of these triggers, because if an environment is healthy, a good environment, then you do not have those triggers. What are those triggers? That I'll come later in my talk. So this topic is very relevant when we are talking of environment, because today there is so much of focus on environmental pollution and how environment actually changes our own lifestyles, our own milieu. There is a milieu actually. We are always trying to create milieu. You are there in your hostel, in your class, so you are forming a milieu. So that milieu is very important, and in that milieu, the most important thing is the environment. You and your environment. These two actually interact. So in the beginning, I'll just can we have next slide? Before I go to migraine, because I should always say that I'm discussing the migraine headache. So briefly, I'll tell you, headaches are of two types. One is secondary headache and one is primary headache. So what are secondary headaches? Secondary headache means that you have something in the brain, like you have some brain tumor, you may have some infection like sinusitis, you may have some meningitis, these kind of things, you may have tuberculosis of the brain, like these are very, you may have neurocystic sarcosis in the brain. So you have something in the brain like infection, inflammation, tumor, all those things. So that is a secondary headache. So that headache actually, that is a new onset headache. So if you have a new onset headache, suppose today you have a severe headache, and you bear that headache, that makes you awaken in the night. So that kind of things. So that is a secondary headache. So secondary headache is actually more dangerous. But there are two things. One is mortality and one is morbidity. मतलब ये कि जीना है लेकिन मर के जीना है. So that is also not good. That sometimes is more dangerous than a death also. So the when we talk of morbidity, then migraine is a very dreaded disease, because it has frequent attacks. It can become a chronic disease for you, and then you may have comorbid things like depression, all those things. So coming again to the topic what I was discussing, so secondary headaches. So these are the secondary headaches. But what is primary headache? So the primary headache are mainly of two types. One is the migraine and another is the tension type headache, TTH as we call. So out of them, actually migraine is more commoner, but yet under recognized. Because what happens, migraine, actually everyone knows, suppose a young girl has a headache and goes to a doctor. So she's diagnosed migraine. So she takes some medication, gets well in around 1 to 2 months. And then again she leaves the medication, again has the same lifestyle, environmental, as I will discuss what is the role of the environment in this. And she doesn't change the milieu, doesn't change the environment around her, again gets that migraine. Now she has become a chronic migraine, a case of chronic migraine. Now she will not bother sometimes. Now when there will be acute exacerbation of that migraine, Then she will bother, yes, I'm really feeling, I have a severe headache, and then she will again go to the doctor, and in that way she will be always depressed. She will not be able to put her whole energy into whatever she does, and that way we are like, we cannot have that positive energy, we cannot get 100% out of us. So that's most important, because we as individuals, to our society, if we cannot give 100%, if we are always feel diseased, then that's not at all good for both us and our society. So coming on to now to migraine. So secondary headaches and primary, these are very basics of headaches. So I just discussed with you, because it may occur with our friends, with our society, family, everyone. So secondary headache, dangerous headache, new onset headache, severe headache, awakens you in the night, you have vomiting with it, but vomiting can occur in migraine also. But new onset headache, if you have headache today, I'm getting severe headache today, 2-3 days, you should definitely visit your doctor. This also it requires importance. But why I'm pointing more and more towards secondary headache, because not only that we are here for just a discussion of these things, but I should educate you on that point also. But if you are talking of migraine and TTH, which are primary headaches, as we say, so these are also important, because these are comorbid, because what happens, this increases the morbidity actually, because you cannot work properly, you cannot give your 100% as I said. So now coming on to migraine. So migraine is not just an episodic disease, it is also a chronic disease with episodic exacerbation, as I said, and many migrants live in fear, knowing an attack could disrupt their ability to work, care for families, and meet social obligation. So this was Lipton, a very famous neurologist. Next. So what is migraine? It is a clear biological disorder like asthma, diabetes, and hypertension. What is it? It's a disorder of the central nervous system. So what happens actually? Brain is hypersensitive to specific triggers and stimuli. And often there is a family and genetic condition. Sometimes it runs in families. Like if your mother has a migraine, you may also have a migraine. And now there is genetic basis for it. I had a study when I was in All Institute of Medical Sciences. I did a study on migraine and seizures. So patients who have migraine have increased risk of seizures also. So overall, now there is proven genetic basis for migraine, and people who have migraine may have their offsprings, their siblings, all those things may happen. Like they may have migraine also. And what is it actually? It is a disorder of the nerve cells in the brain and the blood vessels surrounding the outside of the brain. Next. So there are two types of migraine actually. One is a classic migraine and one is a common migraine. So the classic migraine with aura. So what is an aura? Aura is like when you have migraine, you know that yes, I am going to have the migraine. What you will have? You can have some some dots in front of the eyes, like कुछ ऐसे चिंतला जैसा दिख रहा है, some things like stars, black stars going on in front of your eyes. And then you may have tingling and numbness of your head, all those things, because you know that yes, I am going to have the headache. So that is a classic migraine, and that's not that common. But commoner is actually the common migraine. Doesn't have aura, and the patient starts having the headache. Can we have the next? So auras, as I said, scotomas are their blind spots. I'll just enumerate, zigzag patterns, flashing lights, paresthesia or weakness, hallucination, hemianopsia. Most likely commonly what happens, patients have like blind spot and zigzag, but this is actually not very common. The common thing is the common migraine that I'll discuss next. So what happens actually? There is a pre-headache, like premonitory predormant. So it is warning signs occurs up to 48 hours prior to the headache. So what are the things? There are mood changes, food cravings, yawning, nausea, sensitivity, nausea, very important. And symptoms like visual, sensory, speech disturbance, all those things are there. And in the headache phase, there is symptom sensitivity to light, sound. I'll tell you 3-4 things. I'll tell you what happens in migraine commonly. I'll tell you. If you have a migraine, what will happen? The headache will be unilateral. You will have unilateral headache. One. Second, you will have headache like pulsating, dub, 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 like that. Okay. Then you cannot look to the light when you have the headache. You will feel that okay, I should put off the lights there should be no sound, I should just sleep. So this will be there. So what is that? Photophobia and phonophobia, very common. And then unilateral headache. Then when you will move, suppose you are on a journey, then the headache will be increased. So when the movement of head is there, the headache is increased. So these are the common symptoms. And as in the elaborated here, so sensitivity to light, sound, nausea, and nausea very important. You will have nausea or like vomiting also sometimes. So this is also a common, symptom of migraine actually. Migraine as headache. And obviously, if you have that in long term, then you may have depression. And after the headache stops, then you have tiredness, confusion, decreased appetite, low mood, euphoria. Next. So what is the epidemiology? See, we talk of type 2 diabetes mellitus, asthma, rheumatoid arthritis, osteoarthritis, but migraine is very, very common in society, much more common actually. And these migraine, sometimes, as I said earlier also, it leads to major, morbidity of our society. Sometimes there are migraineurs who cannot work, who cannot concentrate on work properly. There have been so many studies in the United States. We do not have that much literature from India, but we have so many studies from the United States where they have said that these patients who have migraine cannot give their full to their work. Next. The reason being that there is an iceberg phenomena here, that there is 44% undiagnosed migraine, because actually patients take it as normal headache. They never think that yes, I have some disease. But if that disease gets treated, then how much betterment will be there in their normal healthy lifestyles, in their professional and personal lives, that they do not know. So that is an underdiagnosed entity. This is an underdiagnosed entity, and this is the iceberg phenomena, which is very common in this disease. Next. Now coming on to what the environment has to do. What the environment has to do. So there are common triggers actually. What are those triggers? Weather changes, smoke, bright lights, and certain smells. So when we talk of healthy environment, we talk of trees. I love trees and I love forest. So if there are more plants, then we do not have that noxious stimuli like smoke and all. So definitely these are the triggers for common migraine, and for migraine, especially when we talk of migraine with aura. So if we have a better environment, definitely we are going to. If we have lots of sound, this campus is very nice. Why I said that? Because when I entered,